Welcome to our latest installment of our community video update. And this week I'm joined with Margie Kochsmeier, who is our infection preventionist. And Margie is an expert in all things infection control. And she has a lot of really useful information to be able to share with all of you. And I'm very grateful for Margie taking time out of her busy day to come down and to share with all of you. Thank you, Margie.
Messenger RNA, or mRNA, is a new technology, but it's been around for decades. It's been studied. Some vaccines have to have a live part of an organism in order for us to build antibodies, and that's not the way the mRNA works. It gives our body instructions to build a protein that builds antibodies, and once our body builds these antibodies, it can get rid of the instructions, and when our body sees the protein come back in the form of a virus, it will have the antibodies to fight it off. So vaccines are an imitation disease, so they give our body an imitation disease without actually making us sick. There are two mRNA vaccines that are available right now, Pfizer and Moderna. Both of these vaccines had to go through clinical studies, and they were emergency use authorized. So you'll see that abbreviated as EUA. Both are showing to be very effective to fight this virus. In order to be an EUA vaccine, they have to show that they can prevent illness and death and show that they are safe to use. Pfizer is showing 95% effectiveness 2 weeks after the second dose, and Moderna is showing 94.4% effectiveness after the second dose. Well, we need several manufacturers to help get this vaccine out. So you're going to see multiple manufacturers. Some manufacturers of vaccines have pulled out just because they can't show the effectiveness that Pfizer and Moderna have. So know that the vaccines that are emergency use are safe, they're approved, and they have shown that they are effective. Taking vaccine when it's offered to you is going to be a good idea so that we can put this pandemic that has taken so many lives behind us. Strains of viruses change over time, and influenza is a good example of that. So when the strain changes, we have to have a different vaccine. I think this is going to be true for this vaccine as well, just because there's already variant strains that are circulating. I believe we are going to have booster shots, and it's probably going to be an annual vaccination. We're already seeing several variant strains of this virus. And Pfizer and Moderna have both shown that they are protective against 2 of those variant strains. In order to provide enough protection for you from this virus, Moderna and Pfizer studied this and said 2 vaccinations are going to be what it's going to take to keep us protected. For Pfizer, you have to have 21 days between first and second dose, and for Moderna, there has to be 28 days between first and second doses. And boosters will be coming out as these strains that are changing are showing that the vaccine that we currently have may not be helpful. If for some reason you fall out of the 21 to 28 days, you've had an illness or something that has stopped you from going to your second appointment, know that you don't start the series all over. You get your second injection just as close to the first one as possible. Side effects happen when our bodies are making antibodies, and that's what we want them to do. Some people have less side effects. They'll have maybe a headache, or their arm will ache at the injection site. Others may have a little bit more severe body aches or run a fever. But unless you have a life-threatening illness or a life-threatening event that happens following the vaccination, like an anaphylactic reaction, the CDC is recommending that you follow the course and have your second dose. We don't really know why some people have worse side effects than others, but we know that some minor side effects such as headache and the arm ache or just feeling tired happen about the day after the vaccine, and it only lasts for about a day or so, but this is so much safer for you to have one of these side effects than to get COVID. When there's a new vaccine, there's always going to be some hesitancy, and people are going to be anxious about taking something that is new to them. Know that when a COVID vaccine is available in the community, it has gone through all of the clinical trials and everything for safety and effectiveness, so that it's going to provide you the best protection. Nothing is skipped when we have to have a vaccine that is put out very quickly. Hundreds of thousands of people have died from this disease, and when 2 vaccines were found that showed such great effectiveness, it was time to get it out there and get everybody vaccinated. Getting a large portion of the community vaccinated is called community immunity. And what this does is the more people that we can get vaccinated, the vaccine, it leaves it nowhere to go. So it can't be transmitted as easily, and it's not going to work though unless we get about 70 to 85% of the population vaccinated. So we don't want to leave COVID a place to go or a person to infect. Herd immunity is when the large portion of the population is protected and it leaves this virus, again, nowhere to go. There are going to be some people that just can't take vaccine. Kids aren't taking it right now, and maybe somebody who's had an anaphylactic reaction to the first dose can't take it. So when we have a large portion of the population that is protected, it lessens the transmission, it lessens the amount of infection, and it's going to help us stop this pandemic. I have to stress some caution here. While it's going to be safe for us to be, it's going to be safer for us to be with people that are vaccinated if we are vaccinated. No vaccine is 100%, so we still have a possibility of getting sick with it. Remember, it's 2 days before symptoms show that we can transmit it to other people. The other thing is that we don't know yet whether or not somebody who is fully vaccinated, if they come into contact with someone who's got COVID, they potentially could carry it to someone who is not vaccinated. So we need to continue to wear our masks and be careful and social distance. As we get more people vaccinated, I really believe that we are going to be able to look forward to some of the things in 2021 that we were used to doing 2 years ago. After receiving the vaccine, you will still need to wear a mask. Watch those events that you're going to. You don't want to be in a large crowd of people. Can continue to hand hygiene with soap and water or with hand sanitizer. It's going to take about 85% of the population vaccinated before we can say that we can take off the masks and that we're not going to have any more of this pandemic raising our numbers of deaths. The vaccine is going to be an important part of us putting this pandemic behind us. Continue to follow the guidelines that have been set. And you can go to the Illinois Department of Public Health and look at what those guidelines are if you're unsure. We are working as fast as we can when we get vaccine to get as many people vaccinated as we can. Our positivity rates have fallen, and that is very encouraging. It's showing that everything that we're doing is working. It showed this year influenza was the lowest numbers that I've seen. We typically see 500 or more cases, and we've only had 1 case this year. So continue wearing the mask, make good choices for the events that you're attending, and know that the warm weather is coming, and with the numbers falling, we'll be outside and hopefully back to some normal activities.
Thankfully at FHN, we've been able to relax our visitor restrictions to allow people to have some accompanied guest or have that significant other to help them through potentially difficult times. So we're grateful that the decrease in COVID-19 related activity has allowed us to do that. We are continuing to monitor that, and it's certainly subject to change based on different volumes that we're seeing in our area. We are still seeing COVID-19 activity though, so a number of patients have been moving through our doors. At the time of this recording, this day, we still have 6 positive COVID-19 patients in our hospital right now. They're all being expertly taken care of by our team and safely being taken care of. But it's a constant reminder to us that COVID-19 is still out there in front of us, even though the numbers seem to be moving down, which is the right place to go. And I'd like to encourage people to continue with all of the safe practices that they have been doing to ensure that things can only get better. On the FHN.org website, we have a link on our homepage to be able to sign up for that waiting list. And it checks eligibility. We utilize that waiting list, or we utilize that list to be able to contact people as efficiently as possible as soon as we get vaccine. So as soon as we know we have that supply of vaccine coming, we can go to that list, we can reach out to people so that we can schedule their appointments, and we do this by appointment to make sure it's the most efficient use of people's time, as well as allowing us to do things with safe practices in place. So do take the time to enroll in that list, and we'll be looking forward to seeing you soon, or hopefully calling you soon. In the event you're able to get your vaccination someplace else, it still has no harm in being on that list and just letting us know that you've already been taken care of. Unfortunately, as we're filming today, there are a number of shortages with vaccine, and there's different factors that have caused that short supply, and there are lots of individuals that are working to be able to strengthen that supply chain to make sure we do get the amount of vaccine that's needed to safely vaccinate our communities. We've seen things such as inclement weather, which has disrupted our supply chain. Those deliveries have been delayed. We've seen manufacturing slowdowns that have delayed the distribution for vaccines. So we are seeing, a decrease in shortages in certain areas. I know that there are different places throughout the United States that have not experienced as much of a shortage, and some of that is the way that they allocate vaccine. The way that vaccine is allocated in the state of Illinois is it's administered through the state to the local health departments and then to the various health hospital systems or vaccination sites that are being set up. The pharmaceutical suppliers can directly ship to the pharmaceutical chain, just like Walgreens or CVS. Currently just Walgreens in our area, but again, that's very subject to that supply chain, that shipping, and making sure that it's available, and that can flex depending on areas. I'm pretty confident that the state of Illinois is putting a full court press on getting vaccines out as soon as they receive it. And they're pushing out that distribution as soon as it's coming into the state, and they're allocating it out to the different agencies as I've talked about. And the more that's coming in, the faster that's going to be pushed out. We currently have a great capacity with all types of different vaccination clinics that are available, not just through FHN, but through many other channels as well. And all of those vaccination teams and sites are waiting for the vaccine to be able to administer those. I think it's of course okay to be able to get a vaccination wherever you can get it, as long as it's being administered safely. And suppliers such as drugstores are very well trained with their pharmacy team in being able to administer those vaccinations. So where you get your vaccination is less important than actually getting your vaccination. So you should really take advantage of that first opportunity that's made available to you to safely get that vaccine administered. As I mentioned earlier, I think it's very important that we recognize that COVID-19 is still very much affecting our community, and that we need to continue those safe practices such as watching our distance, wearing a mask, and washing our hands. And at the same time, as we get back to more normal type of activities, is doing so in a safe manner and being smart about the actions and the steps that we take so that we can continue our journey to alleviating and getting through this pandemic together.